In this video, we will take a dive into the multiple mini interview format. Let's start with a general introduction to the MMI format. This format consists of short, highly structured interviews meant to standardize the interview process and remove potential bias. Here you will receive 1 to 2 minutes to read a scenario-based prompt and brainstorm your response. You will then enter the interview station, meet your interviewer, and provide a 5 to 10-minute response. If anything is unclear with the prompt, it's okay to ask questions. The purpose of this format is to test your ethical decision making, critical thinking skills, communication skills, and knowledge of current healthcare and social issues. Many members of the DAT Booster team have both participated in and conducted MMI interviews. They have told me that applicants are evaluated on response quality, meaning the reasoning and support for their responses, rather than the response nature. So there is really no right or wrong answer. Essentially, if you have strong reasoning and support for your response, you will be set for the MMI format. On this slide, I've included a general outline for your responses to MMI questions. It starts with your introduction, where you can briefly explain the overall goal in the provided situation. This will give direction for the rest of your response. You then move on to the body, which is a step-by-step explanation of how you plan to achieve this overall goal. It's important that you include reasoning for your actions throughout the body as it gives substance to the actual response. Lastly, you can conclude your response by stating the result you hope to achieve by following your plan. If you want to go a step above and beyond, you can answer the question, if events do not go as planned, what is your alternative response? Here we have an example MMI question. An adult enters your office with severe dental decay. You suggest multiple forms of treatment, but he refuses each option due to the cost of the procedure. This patient does not have dental insurance, and his current salary is too low to both care for his family and receive proper dental care. How would you respond? In your introduction, you should state that the goal in this situation is to provide the patient with cost-effective dental care. You then move on to your body, where you propose a specific solution. So I've included some potential solutions on this slide. You could connect the patient with local dental clinics or dental schools that provide treatment for a reduced cost. Alternatively, you could perform the procedure for a reduced cost. Or you could connect the patient with federal or state dental insurance plans for low-income individuals. You can then conclude your response by saying, I hope that by blank, this patient will receive the best dental care at a reasonable cost. If you want to go a step beyond, you could answer the question, if the patient refuses your proposition, how would you respond? Not every MMI question will center around dentistry, and I've included such an example on this slide. So you are at a grocery store and see someone pull into a handicapped stall without a permit. At the same time, an elderly woman in a vehicle with a permit is looking for a spot. How would you deal with this situation? You can take the same approach and outline that we discussed earlier. Starting with the introduction, you should state that the goal in this situation is to assist the elderly woman in finding a parking spot and entering the store. Moving on to the body, here are some potential solutions. You could forfeit your parking spot to the elderly woman and assist her in entering the store. Alternatively, you could confront the individual who illegally parked in a handicapped stall. Or you could help the elderly woman find an alternative parking spot. Regardless of your solution, it's important that you have strong support for your response. At the end of your response, you can conclude by saying, I hope that by blank, the elderly woman would find a parking spot and safely enter the store.